we are taking care of common rare cancer, and we are trying to fight inequalities in Europe, and we are trying to work for allowing patients to have access to the best therapy in a short time. And for doing this, we are trying to follow innovation, and innovation is very important for cancer patients. The problem is that with innovation, we should reduce inequalities, but we feel that inequalities are increasing with innovation because the innovated new therapies are having a higher cost, and it's much more difficult for patients to have access to them. What we feel is that the best innovation that reach patient late is not an innovation for patient. And the other thing is that innovation should be helping all patients and not only some of them. We are taking care of being part of innovation, and then we feel that it's not enough to have new therapies if we don't have a very well working healthcare system, because the healthcare system must be online with innovation to be sure for the patient to have access to these innovating therapies. And we are working also trying to allow patients to be part of innovation. So we think that we should be more present, and the European Commission, European Cancer Patients are present in the expert commission that has been just created a couple of years ago by the European Commission. But we as a patient should be more involved also in the biobanking organization. For example, we feel that it's very important that the patient are those that are allowing biobanking to exist, but they have to get some feedback from biobanking, and we are trying now to write down a new informed consent, having for the patient the possibility to be informed about the feedback of the results that are coming out from their samples, and also to make sure that a part of the sample that's been given to biobank is just kept for the need of a patient for future kind of diagnostic use. So we are trying now to work also for giving our contribution for the best outcome from innovation. The best come out innovation is also important to be given through the healthcare assessment of new drugs. And we feel that it's also very important to have to give a higher value to a pharma that gives the best outcome. And the best outcome for patient is also quality of life, and is also the opportunity of taking in consideration also the social involvement. And for this, we think that patients should be involved in the HTA assessment bodies, as already NICE did in UK, but we are also appreciating that the EMA is allowing patients to be present since the beginning. Also in the adapting licensing, they are calling patients to discuss with the HTA assessment of the initial work done in clinical trials. So this meeting was very important because we could first of all ask to clinicians and scientists to take care of the value that innovation has for patients, and also because could be a good opportunity for us to know more about what's going on and how we can be lobbying for ensuring patients to have access to the best innovation very soon without having a delay that will not be used for the innovation to patients. We know that by cancer genomics, and we know that having the opportunity to follow the cancer DNA in the blood, now there are many more opportunities for a patient to ask for a very highly personalized medicine, and this is very important not only for all patients, but it's also very important to save money, not giving very innovative medicine to patients that will not be used in the right diseases. So then all this progress that is going on will be just told from us to each patient organization, as we are doing in our website, because in the website European Cancer Patient Coalition we have an immuno-oncology portal that is giving in a very easy way, also in animation, through animation, a clear picture of how immunotherapies and immuno-oncology is working, so that each one of us in the patient organization know how things go, and then afterwards they can tell also to patients what do they could expect from immuno-oncology that is now a breakthrough in the new cancer therapy.